¿Listos?
Ready.
Listos.
Well, let's get started. Señores, thank you so much once again for accepting my invite. One more time, I'll tell you that I'm very excited about today. Actually, it was an idea of one of my friends that said, you know what? With COVID and everything that's going on, you should actually interview people that interact with COVID on a daily basis. You guys being first responders, of course, you interact, and that's what I really want to talk about today. I want to make sure that whoever's listening gets some value from this. All I ask is just be yourselves. Again, this is a conversation, so let's get started, guys. And again, thank you so much for your time.
No, thank you.
Nice. Okay, pues vamos a empezar. Tell us, guys, give us a quick intro on who you are and what you guys do. We'll start with Christy.
So my name is Kristine Tejeda. I am currently the Pediatric ICU manager at El Paso Children's Hospital, but prior to a couple months, or October of last year, I was the education manager for the facility. So I've been there for about 5 years now.
Oh, okay. So tell us a little bit more. Like, how long have you been in this current role?
I started as the ICU manager in October.
Okay.
So my background, I've been a nurse for 8 years. Mostly I did pediatrics, I did adult PACU, I did pediatric home health. And I went back and I got my master's degree because I really was wanting to inspire the next generation of nurses, right? How do we elevate nursing in the community to the next level? So I got my master's in nursing education because I wanted to be able to teach nurses. And from there, I've just done leadership roles. The current department that I work in, so the pediatric ICU, we work directly with the pediatric patients that are diagnosed with COVID. So those patients, we have them on our unit.
Wow. We're definitely going to talk about that. So thank you so much, Christine. Jose Luis, go ahead, sir.
Well, my name's Jose Luis Salas. I'm currently the infection prevention and control director for El Paso Children's Hospital. A little bit about history. Whoa. In 23, I'm going to be 20 years in nursing already. Yes.
Oh, congrats.
Yes. I started at 18, so I was one of the first, the first programs here in the city as far as from the LVM program that we graduated directly from high school. You graduate as a nurse. I remember very well.
Which high school, by the way?
Bel Air.
Okay.
Bel Air Magna, I gotta say. Go Highlanders, right? But it was interesting. I remember the first week of working as a nurse. I remember the patients like, "Are you sure you could do what you're doing?" And I'm like, "Yes."
That's funny. So now it's been 20 years since that.
In 23, next year, I'll go on 20 years already doing nursing.
Tell us a little bit about your current role. It sounds very fancy. Tell us exactly, no, not exactly, but give us an overview of what you're in charge of. What are some decisions you make on a daily basis? Talk to us a little bit about that.
Well, for the most part, I feel that infection prevention and control is one of those behind-the-scenes departments. Sort of like, if you want to think about it in layman's terms, like a theater show, right?
Okay.
There's that production in the back. You're looking at the guest and everything has to operate smoothly so everybody could see the show appropriately, etc. But we're behind the scenes to make sure that everything remains steady. In other words, we're doing active surveillance, perform of any of the positive micro that comes into the facility. What can we also do as far as minimizing the potential risk of of infection amongst patients? But not only patients, I also have to see the the well-being of the staff, as well as the well-being of any visitors that are coming into the facility.
Ooh.
So I know that right now it's reminding me one of the things that when I do education on the employer orientation, and I remember watching The Lion King. Do you remember that part where it's Simba and Mufasa, where they're looking at the prairie and they say, "Look, Simba, everything the light touches is going to be yours." Sort of that's the responsibility of infection prevention and control. We have to be looking at the food that's being served in the hospital, to how it's being disinfected as far as all the equipment, the linen, that it meets the degrees of disinfection, hand hygiene, that the nurses are disinfecting their hands, that they have the PPE, and then we also have to look at the devices. Kristine, that's where we really merged a lot together when I joined the organization, and she was very welcoming me joining on the team. We have to look at the central lines, the devices, any device that you get placed, Foley's, central lines, ventilators, all those are components that I have to oversee to make sure that there's no risk of infection. Because the longer the device stays in, the higher the risk or the probability that you might develop an infection. And not so much that you came in with it, it's just that you'll develop that infection while in the hospital.
Wow. Okay. I definitely have a lot of questions for you. I once again want to thank you for that. And I mean this as well, but I want to thank you as being first responders. You guys are there. As I think about how my life has changed since COVID, it has changed a lot. But when I compare like kind of like the things that I don't like to do, or maybe some of the new duties that I have to do because of COVID, like nothing near you guys, and you guys are heroes, to be honest with you. Ahorita no se pongan a llorar. Now, by the way, so you do a lot of forecasting, a lot of course, in the future, look into the future as far as possible cases, possible spikes, and all that. We definitely gonna talk about that. I just want to recommend you the episode with Ricardo Samaniego. He talks about that, and I'm like, oh, okay, because we again, when I say we, it's like the common folks, like we don't like think about, hey, but like maybe right now the decision, we don't like it, but it's being done, or maybe because of something that's gonna happen, or we're again thinking that might happen, and we want to be prepared. So lot of questions.
I listened to it.
You did?
Yes, yeah. I'm halfway through it right now, and it was in September.
Yes.
Where he was anticipating that, hey, you know what, right now we're good and so forth, and now that you reflected, and look, right now we're standing on January 20th, 2022. And we are seeing one of the biggest spikes, and not just locally, but across the nation.
Yeah, te digo la verdad, I really thought that was the last time I was going to talk about COVID with yes, I know. We'll talk about
I have a really good example.
Okay. We'll definitely go over that. Now, another reason why you guys are here, which need to share with you guys, for Christmas, I got COVID. It's been, I never, like 2 years COVID free. And I interact with a lot of people, especially because of the hairstyle. Thank you so much. And I'm like, wait a second. Because I like all those variants that we're going to talk about that, like you hear, I'm like, you don't know, again, as me, like as far as like what to listen to, who to listen to. So I'm like, tan locos. But then when I got that variant, like, wait a second, I haven't gotten in 2 years. And then kind of like some of the symptoms I had with my Christmas COVID, like, oh, okay, now I'm a believer on variants. So very interesting to talk about.
But I have a question, though.
Yes.
Are you're vaccinated?
Of course I am. Of course I am.
That's one of the things that you got to say that, great, because that's what helped as far as for you. I don't know what the symptoms you had probably in December, right? But probably mild.
Very mild.
That had not probably been the case prior to you getting it, prior to vaccination.
Why do we still have, and I have Facebook friends, no, I actually have friends that even go to my house that are 100% against the vaccine. They really think that the government's tracking it. Well, maybe not this guy that I'm thinking about, Cifuentes, by the way, but a different friend that they think that, no, you know what, we're guinea pigs or something might happen. And I get it, but at the same time, kind of like there is data now. So what are your thoughts on vaccine? Let's go ahead and move on to vaccines. Let's go for it.
It's interesting, though, because I think part of that is the misconception that it's like a new vaccine and that there was very limited testing. There was very limited. And that's not necessarily the case. So I just wish that there was more information about how the vaccine was developed.
Okay.
And that was more widely available. And I know that you touch on that, on how the testing and stuff had started years ago.
Yes. Well,
years ago.
Correct.
Come again?
Well, let me give you a little bit of history.
Yes, please.
It's like, yes, we hear coronavirus, right?
Yes.
And everybody's like, why are we calling it corona? Oh my God, poor the beer industry, right? That they're going to suffer on this. But no, coronavirus has existed since the beginning of humanity.
Wait. Me estás diciendo que it wasn't this chinito that ate a dragon, a vampire, what was it, a bat? What's going on here?
No. So we have different strains of coronavirus.
Okay.
So you have your common cold coronavirus, which is like the one you get, right? And then you have your SARS coronavirus, which is what we're currently experiencing. So if you recall back, I believe in the beginning of 2000s, we had, which was SARS 1.
Like the main
the main
COVID,
one.
right?
Yes, I'm
The
trying to.
bird flu, I think is what they would call it.
Yes. No, that was the swine flu,
The
no?
The swine flu. That's the one from.
Oh, that one's also related?
That's another one. Yeah.
Okay.
But I'm trying to remember though. It's the one that the right now that just went off my brain. I apologize, but it was back in 2001, 2003, around there. But that was able to be contained because why? We have the World Health Organization, so they're able to contain it, right? So that it never left China, and so that's epidemiology. That's infection prevention. That's that realm. That's those professionals to ensure that it keeps encapsulated and it doesn't. It's an epidemic within the region, but it's not a pandemic, and that's why right now we're having a pandemic, which is worldwide.
Okay.
So great, we didn't spread, right? And then we had the Middle Eastern as far as coronavirus, SARS. That's another one. And as far as SARS, it's because it's Kristine actually, it was a great podcast that explains it. It's called This Podcast Will Kill You. I recommend it for you guys.
This podcast will kill you.
Yes, it's a great podcast as well. I don't know if I could.
Only the nerds that love infection prevention.
Correct.
Yeah.
Yes. And so it explains it more in depth as far as like how it affects. But again, we had that in the Middle Eastern. It was called MERS, right? MERS coronavirus. Again, you don't hear from it. Why? Because it stayed locally. And again, the World Health Organization really zeroed in and fought it out.
And that's how they started in some way working on.
So since the early 2000s, they've been working on vaccination. And so unfortunately, there's no funding on this. So what happens? If you're not affecting globally, and como decimos con dinero al perro, it's like it's not affecting those global markets, then there's no funding for it. There's really, and I could give you that in a personal experience. I have my other degree is in biology, and so there's another disease over there for Chagas disease, and there's a vaccine that's almost already finalized in our local at UTEP with one of the professors. But unfortunately, it's just going to stay there in the sense because it's not really affecting anything.
There's not a big need like there is right now.
In South America, there's a huge need for it. You know what I mean? But unfortunately, it's not affecting globally. So that's what sort of happened to like the vaccine creation of where we're currently right now. Until now, you affect a whole system. Now there's endless funding into making this vaccine. So technically, like the basic infrastructure had been there, and that's why we were able to create it and actually bypass certain things because they've already had certain research from this coronavirus or this SARS originally. Wow.
Okay, that's
but unfortunately, it doesn't get educated on. That's why people are like, "This is a new vaccine," and I get it where they might have reservations into receiving it.
It's one thing to have reservations. I had reservations. I was like, I'm healthy. Again, I got in December. Like we're talking about like the first COVID wave. And I had reservations. I was like, wait, I'm healthy. I'm okay. And it's been maybe 6 months, a year, and I haven't gotten sick. So I'm okay, right? But what made me or motivated me to get the vaccine is like, I was seeing other countries, like people fighting to get it. Y yo nomás por payaso, I'm like, bro, just get that, right?
The privilege that we have within our
just get it.
country.
And again, that's why I'm so excited about today to hear from experts, people that deal with COVID on a daily basis, instead of seeing a post from China or from Missouri or Michigan about maybe something that happened to a specific person that perhaps might be fake, quién sabe, and now that person, because of that video that they saw or that meme or that picture, oh, look, guys, this is what they want to do to America. It's
going to influence.
Relájate. I mean, there's so many
but
things
it can be very detrimental.
Yes.
You know what I mean? And I was listening to NPR where one of the physicians relating a story where he says that right now with the current spike that the majority of the people that are hospitalized right now at this current state is people that were not vaccinated.
Is it, let me interrupt you, is that happening in El Paso as well?
Yes. Majority, it's people that are unvaccinated, that they're being hospitalized. But the sad part where this physician relates is where he's indicating, hey, now the family is like asking, can you vaccinate them? But at what the patient's already intubated. You know what I mean? It's already too late as far as the vaccination to occur.
Yeah. Wow. No, I'm so glad we talked about that. And again, we're going to continue talking about that as well.
Okay.
Pero just to end that, at least that piece is, Cifuentes, please, vacúnate ya, déjate de payasadas. Christy, when it comes to children and vaccines, how you feel about that? Like,
I can totally respect, because I'm a parent myself.
Mm-hmm.
I have 2 children, so I respect people, having reservations. What I wish people knew is I think there's this misconception that COVID doesn't affect children. I see it all the time. I think we both still have the bad habit that we still read the comments. I know. I aspire to be like those celebrities that are like, I don't read the comments, but I think I still read the comments, and sometimes, to be honest with you, it's frustrating because there's this misconception that
then you want to reply, right? To hey,
yeah.
Okay.
But we absolutely don't
course.
reply. But it's frustrating because there's this misconception like kids don't get sick. For the most part, it doesn't affect children. And I'm not gonna lie, sometimes I'm like, walk through the halls of our unit and tell me that kids are not being affected. Come talk to these parents who are in an ICU for 30-something days, whose child is intubated or has a chest tube and had no previous medical history, and tell me that kids aren't affected. So absolutely, the day that the vaccine was available, my kids were first, one of the first ones that.
I'm so glad I asked you that, and I'm glad, of course, that you have kids and that you are first to say, my kids are getting vaccinated. You're someone that deals with that on a daily basis.
Correct.
Absolutely. And I think it's interesting because, sometimes obviously every parent is concerned with what they, put into their kids and things like that. But then I'm like, they eat McDonald's. We give the, kids soda, all these crazy things.
Artificial
preservatives,
That we know that there's research behind.
Of course.
Yeah, there's like tons of research telling us, the detrimental effects of things like soda on kids. So I think that's just unfortunate. And yeah, absolutely. I think we have had the majority of the pediatric patients that we have had some that, because not all the kids get sick that get COVID. Not all of them. Some of them have mild symptoms. You have to understand that asthma is pretty prevalent in our community.
Mm-hmm.
A lot of kids in our community have underlying respiratory conditions like asthma or obesity, things like that. So it's important for those kids to be protected, but a lot of the kids have no underlying conditions and they just get really sick because we don't know how their immune system is going to react to these things. They're little. They've never been exposed to these viruses and pathogens. And right now it's pretty tough because it's also our normal respiratory season. So the fall, winter, all the kids are all mocosos already. You know what I mean? We're already busy. So it's kind of a hard time to compound it on top.
Yeah, and that was me before, by the way, with my sister. I have older kids now. But then it was like, no, pues los niños no se enferman. They'll be okay. Yeah. You know what I mean? And it's like, no, wait a second. They do. Maybe it's not as severe. I don't know. What is one of the biggest differences? Of course, it's not as severe because they don't have as many underlying issues as adults. I'm thinking. Yeah. What else? Why is it that
it's interesting though? But I think that we haven't been seeing this for long enough in children. Mm-hmm. So one of the things that is still it's not going to be clear for a while until we've researched this enough, is we have kids that they have strokes, right? No underlying conditions. Other children who, let's say they go into DKA, diabetic ketoacidosis, or children that have multi-system inflammatory diseases, right? Like inflammatory process issues. And then you test them and they test positive for COVID antibodies. So it's really hard to be able to say, did COVID cause these complications like the stroke or like the diabetes, like onset of type 1 diabetes? We don't know because these, it's too soon to be able to absolutely say, no, this did not result in, this kid having a stroke 2 months after he was diagnosed with COVID because it hasn't been studied long enough. So me as a parent, why am I going to take that chance? Why would I take that risk if I could just vaccinate my child?
Yeah. Now, does the same thing work, meaning with adults? Have you seen the same thing that children that are being hospitalized, are they also the majority not vaccinated? Are you also seeing the same trend as adults?
Yes. I have the majority of the children that we see.
Give me a percentage, please.
Oh,
Just, it doesn't have to be accurate. Just give me 70, 30.
About 70. 70% of the the patients we see, they were unvaccinated. And the really, really sick ones, they're probably about 80 to 90% unvaccinated. Wow. We have noticed that the ones that are vaccinated, they probably don't have as severe symptoms. They could probably just need a few, maybe respiratory treatments and things like that.
I think I know what the answer is, but let me ask you, recently, or even since COVID started, children passed away due to COVID, like that you were taking care of?
Yeah, in the city, we have absolutely had children. And that's not, that is absolutely being reported. If you look at the city data that is presented on a daily basis, you'll see AP Strong. They absolutely have.
¿Qué es el más chico que te ha pasado a ti that you have seen? Because that data, like, of course, is there, and I know it's a fact, but
they've been teenagers.
I just like that you have been taking care of. Yes.
That I've known of, they're teenagers that have passed away.
Did they have underlying conditions? What was it? Can you expand a little bit on that case without saying names, of course?
So these patients have been taken care of by my peers. I won't say that I took care of these patients personally, but these patients do have underlying conditions. And so if you think about it, vaccines for children haven't been around as long as they have been for adults. So
is it different, the vaccine, though? Or what do you mean by that? It's the same vaccine, no?
It's the same vaccine. It just hadn't been approved.
Oh, okay, the dose.
Okay. They had to do testing to see what dosage was going to be able to be approved for children. And so it's a smaller dose for children.
And it's always challenging as far as when it comes to children, right? Nobody's like, here's my child, let's put them on this study. And that's one of the things that we see when it comes to healthcare for children. That's across the board. Vaccines, even devices, like all devices, everything, even solutions that you use to bathe them and so forth. There's very little, there's not a lot of studies out there as opposed to like in the adult setting when it comes to healthcare care.
Because you're not going to get a lot of people saying like, hey, use my kid as the test subject.
Yeah, and I wonder if it's cultural or just maybe does it matter that we're used to like kids always get sick, well, regardless, no? So we're like, no, si lo tienes, se le va a quitar. And again, without really thinking, analyzing, thinking, hey, bro, just do it. Because again, if I'll be 100% honest, if I'm hearing this from you, that again, you work on a daily basis with COVID in a hospital, that you're the first one to say, my kids are getting vaccinated, yo le digo a mi hermana, hey, vacúname a esos niños de volada. You know what I mean? And that's what I want instead of like the meme. Because again, I'll be honest with you, like I do try to watch or read like the serious news or... Pero me aburre la verdad, y lo veo un rato, and I prefer to watch kind of like what entertains me. And I think most people are the same way, right? So that's why it's very important to me, like when I have a conversation like this, instead of going based on a friend of mine that heard from another friend that heard from la tía that esto le pasó, and because of that, in my mind, I'm like, no, pues let's not vaccinate the kids.
No, which is... let's take a step back. I'll be honest with you. I feel like it's very interesting we need to look at what last year to this year. And I think that's one of the things that people should be encouraged to be vaccinated. Reason being, last year we were in lockdown. We were in complete lockdown. So technically, fine, if you choose to not get vaccinated, you know what I mean, you're in for the flu. If you were staying at home, then that most likely 90% of the time you weren't going to get the flu. You know what I mean? Now everything was closed. You know what I mean? And plus there was mask mandates, etc. Now this is a very different scenario that we're in, right? The schools were closed last year. This time schools are open. Masks are technically not required. You know what I mean? Everything is open right now. And so that's why we've seen an increase of RSV, all the other things that are just coming up. Because last year, that's what sort of reflects, you know what I mean? Masks work because it contains it, you know what I mean? And that's what really helped. And that's where we're now seeing an increase with children, you know what I mean? As far as COVID numbers, they continue to spike within the community. And then we think, well, why? Well, because schools are open, right? And if it's not mandated, then there's going to be that transmission that's going to be happening.
Como me dice mi niña, it's highly encouraged. That's what they say in school. But if the parent, not even the kid, makes a decision, the parent, you're not wearing a mask or whatever, ¿qué crees? Pobre niño, ahí anda. And again, I'm not saying that's the right approach or not. I want to really talk about masks, and I'm going to give you my opinion on masks. But as far as vaccines go, again, Do you guys, and this is more of a personal question, is there one that you prefer? Again, your personal opinion, or sabes que all of them have been tested. Of course, they all been administered, so they had to be tested. Of course, but one saying, like, porque oyes también, like, from family, no, la Moderna, no, or like Johnson & Johnson, or the Pfizer. I don't know. You hear that, and I just want to hear it from you guys.
Como un dicho, ¿verdad?
Okay.
Cada cabeza es un mundo.
Yes.
¿Verdad?
Uh-huh.
So every single body reacts different to the vaccine, right?
Okay.
As far as all the research that has been behind every single one of them, they all have a very good way to protect you.
Okay.
Now, could I tell you that Moderna and Moderna and Pfizer are better than Johnson? In the sense, yes, because it does give you up to that percentage of immunity, 95% for Pfizer and 94% for Moderna. And unfortunately, for the Johnson & Johnson, you're at that 70%. But the advantage to that is for individuals that might be afraid of needles and they don't want to follow up their 28 or 21 days later on to get it, then that's the great thing for you to do, right? But just understand that you're only covered up to 70% versus if you get that additional shot, it's going to take you up to that 95% immunity. I mean, it's an individual assessment that you have to do as far as what is your risk factor that you want to do. Are you putting yourself in a predicament in a large crowd? Or are you going to basically, okay, fine, you know what? I don't want to do the 2 series. Or I hate needles. I don't want to get, you know what I mean?
Or you live in a community or an area where it's not so accessible, right? So there's going to be areas where, we can't go back for the 2nd and 3rd dose. And it's not as easily accessible as it is for us. And so that's why I think there's a place for each vaccine.
Yes.
That makes sense. Because I used to work out with the fire chief of El Paso, Mario. Saludos. Hi, Mario. And he just told me back in the day that the city employees got the Moderna one. And I'm like, wait a second. Do they know something? I don't know. Just trying to.
Oh, we can give you a little bit of background about that. So in the beginning when the vaccines came out, because we were really involved in the vaccine administration campaigns, the Pfizer vaccine, which was the first one to come out, it needed like sub-zero refrigeration. And so very few facilities had that. So they weren't able to administer that vaccine to just anybody because who has, a sub-zero freezer.
And it was large. Yeah.
So Moderna didn't require that. It was a little bit easier to administer. So it doesn't necessarily mean that one was better than the other. It just means what is easier to administer to this population in this area.
Yeah.
This is so true with so many other things. Paso, we were talking a little bit about kind of the reason why I'm doing this, that we just hear something and we just go with the first thing that comes to our brain, right? Like, I'm hearing the Moderna and me say, no, pues that's the good one, no? Okay, that's the city. Wait a second, 100%, of course, there's a reason behind that. You just have to open your perspective and understand there's maybe a reason that you don't understand or you do not know of right now, but it doesn't mean that the reason why que tu tía te dijo, that's the right one.
Yeah, it was just
that
the storage,
applies to so many
how
things.
you were able to store it.
Wow. Okay.
Because we had to come up with those same situations too, right? So where were we going to be administering the vaccine? Were we going to be physically at the hospital where we had this sub-zero, freezer?
Plus
or were we going to be out sometimes we were out in a parking lot? What were we going to have access to? So which vaccine were we going to administer? Were we going to be able to get these people to come back? So if it's hard to reach these communities, is it easier just to administer the Johnson & Johnson?
Yeah, it was one of those things also at the moment that you're popping open a vial, that thing's about to expire within a certain time frame. And so at that moment
that was horrible.
It was God,
horrible.
Yes. But I'll be honest with you, at the moment we received it, me and Kristine and our team, we were like, you know what? I get it. It's Christmas Eve. Is it 24th?
Yeah.
And we're like,
2020, all the holidays.
This is our job. This is our dedication. And so we were there the 24th, the 25th, the 26th, New Year's, the whole thing, vaccinating. Because we're like, we're not going to delay this. The more we delay, it's the more we delay and the one vaccine that we don't use within that time frame is one person not getting vaccinated that might have a negative outcome.
But that was actually really hard because, like he said, it was 6 vaccines per vial. So let's say you had 5 people make an appointment, right? And so you're like, okay, I have my 5 people. And then all of a sudden someone didn't show up. Oh my gosh, I have this extra vaccine. I'm not going to waste it. We're not going to waste it. Let's find people. And it got to a point where we were not going to waste it. We were like calling the neighbors, we were not going to waste the vaccines. And we would stay hours. We would stay until like midnight if we had to, because we were not going to waste it.
And this is starting at 6 in the morning.
Wow.
All the way till midnight at times.
We were going to find an arm for that vaccine.
Yes.
Guys, thank you so much. I know you guys make it seem like, oh, but now that's just what I do. But like, most people are not like it. Like, God.
It was really challenging because, and don't even get me started with second doses. Because second doses, that was even challenging because then it's, like you said, right? Comodidad.
Yeah.
I can't recall the word in English, right? But, people were like, well, you know what? Especially when we were doing it, it was like, well, I'm not going to be here in town during that time. And I'm like, oh my God, now we're off on the number. And again, the same challenges every single day when we did a clinic. I was like, we are not wasting this vaccine.
That's funny. Let me share with you guys a story about my mom, right? Me dice when the vaccine started was being available, right? Me dice, y ni te tomes la Johnson & Johnson. No, la Johnson & Johnson, no. Because there's a lot of recalls on other products, not even like medical. Y yo, mamá, ay, Dios mío. Mom, yeah, okay, la escucho, pero she was very adamant not to. Okay, and then I don't know if you guys remember what happened to the first Johnson & Johnson, that there was a recall. ¿Quién cree que me habló? Mi mamá de, te dije, tío. Oh, that's the worst thing that could have happened, because now my mom has that was que te dije about the Johnson & Johnson, about the recall.
Yes, Telemundo.
No, deja tú, because there's, again, so many misconceptions. But then she does have that she was right that time. Seriously, because I'm like, oh, okay. Pero bueno.
But you know what? At the end of the day, I feel like with vaccines, it's like, I feel like now we have a weapon.
Yeah, definitely.
To fight this.
Yeah.
Which, unfortunately, in 2020, March, throughout that whole time when that vaccine became available.
It was the most amazing thing to see people get their vaccine, and for a lot of people it was just relief. Like
you could see it in their face.
Yeah. And correct me if I'm wrong, but one thing that, again, my personal opinion is that even if it just I don't know what you call it, that it's nothing that they're giving you a shot. ¿Cómo se llama?
Placebo?
The placebo. Even if you're just being just water, but you knowing and getting that extra energy that, no, I'm protected. Again, my opinion. So es que that goes a long way as well.
Because imagine how many were unfortunate that they would have loved to have had the opportunity to be vaccinated.
I mean, we were right there where we work. We work right in the UMC area. I mean, you saw the trucks with the bodies. It was so eerie going to work every day.
That's where we parked.
Yeah,
to go to work.
That's what Judge Samaniego talked about.
Yes,
that especially about that. Remember, you guys at the beginning, people not believing that there is something going on.
We saw it every day. That's where we parked.
There's so many. I mean, you guys can just recall that. And then what Judge Samaniego did a great job saying, it's exactly that. So es que I see it. It's happening. I interact with first responders just like yourselves. And it's happening. Y como nosotros, and I'll include myself, just being at home, working from home, looking at Facebook all day. Well, maybe they do have a point. Maybe there is nothing serious going on. Yeah. And again, that just proves that you need to talk to the right people. No, nomás
and I applaud Judge Samaniego because I think he was one of the public officials that, went out on a ledge, a lot of courage, and kind of kept us going, because I'm not going to lie, there was a lot of times that we were like, we'd never gone through a pandemic. Like, this is the first time for us, too. Like, are we doing the right thing? It gets discouraging. I be here, right? And especially when you go into a profession like nursing where you don't do politics. Like, I'm like, I signed up for nothing to do with politics. And all of a sudden you're the villain and you're wrong and you're brainwashing and you're a sheep, and it gets kind of demoralizing, right? But he was always very supportive of us.
Well, Judge, some of you have my vote, by the way. Pero that's 100% true, Tejo. And we listened to a doctor on Facebook, que quién sabe dónde era, that we think that he's a doctor. We don't even know. And that's why.
They put his MD at the end, and
let me ask you guys this. 2 years after, it's safe to call it January of 2022, right? 2 years after everything started, is there still a lot of misinformation out there?
Yes. on a daily basis.
Okay, to what, again, not exact number, to what percentage? Because when 2020, te aseguro que there was like 100% or 90% misinformation. Of course, with the facts and the things that we had, all the data, I'm sure that went down. But in your opinion, if you can put, I like numbers, by the way. If you if you can put a percentage that so I think that out there on Facebook, on the news, or with friends, there's still a 30% misinformation, 50, 60. Would you guys be comfortable putting a number?
I feel it went up. I don't know.
No, me digas eso.
Because I think all of a sudden it got politicized.
Ooh, what do you mean by that? Explain yourself.
All of a sudden, if you believe in the vaccine, if you believe in, it seems like...
And mask, if you believe in...
I want to talk about masks, for sure.
If you believe in the CDC, if you know what I mean, it's just... At what point do we take face value? Like, at what point do we stop believing in science? You know what I mean?
What's the biggest misinformation? If you had, which you guys do have, a couple minutes to say, you know what? There's so many things going on, but the one that I've seen that bothers me the most that I want to talk about is this.
For me, because I see it every day, is that COVID doesn't affect children. And I think that is
to get them vaccinated or like, ¿qué más?
And to protect them, right?
Okay.
To make sure we instill in them hand hygiene and mask wearing if they're in high-risk situations, that you vaccinate them, right? I think I don't know where this happened, where all of a sudden people think kids are completely immune to COVID.
Oh.
And they think, my child doesn't have any underlying conditions. But a lot of times, when do we get diagnosed with underlying conditions? It could be years, right?
Yeah.
So, okay, your child might not have any diagnosed underlying conditions because they haven't presented with symptoms yet, but we don't know that. We don't know that it's, heaven forbid, right? But that a tumor isn't brewing, or that they don't have some sort of underlying blood condition, or that they don't have, diabetes that is running in genetics, or that they aren't going to have an asthma exacerbation if they get COVID. So I hate that everybody thinks children are just completely immune and they could never get sick.
Okay, and the best way to help them out is, of course, getting kids vaccinated, and also, what else?
Teaching your children to protect themselves, wear masks, which I myself, this is like an every single day. I totally get it. Mm-hmm. Reminding my kids, you're not wearing your mask. Your mask is not, being worn appropriately. Washing your hands, hand washing. Even just teaching your kids.
The hell on, it's going to prevent so many other things, not only COVID, but yes.
COVID, exactly.
Yeah.
I think one of the number one cause of death, like worldwide, is like infectious diseases having to do with, diarrheas and stuff like that worldwide.
Yeah.
And hand hygiene prevents that alone. So just teaching your kids how to properly wash their hands is very important.
I like that. How about you?
It's like right now we see a correlation. Think about it. Last year, if you do your research, last year, children's hospitals were at an all-time low hospitalizations as far as numbers, to the point that adult facilities had to come into children's hospitals to utilize those as beds because of the high numbers of people hospitalized.
And that was because
there was no kids. You know what I mean? The kids it was closed. We were in lockdowns. We were wearing masks. We were doing all the necessary precautions. So it's a quick correlation that those numbers of infections went down. Mm-hmm. Right now, you see it all across news. Now, children's hospitals, the census continue to go up. Now, more are getting infected. What changed from last year?
Yeah.
What changed?
Well, ya nos vale madre for the most part.
We opened up everything. We don't mask mandate. We don't have mask utilization. You could use it if you want to or not. Mm-hmm. And so that's a clear reflection as to a difference from the previous year.
And that makes sense.
As far as me, you're asking me what for me. The fact that we went through this 100 years ago. 100 years ago. History is bound to repeat itself. The Spanish flu, we had that as an example.
But when I ask you, what is the biggest misinformation, what you mean?
As far as we go back to behavior, knowing, giving that sense of security that, hey, you're vaccinated, you're not going to get COVID.
Yeah.
For example, I'm going to give you one of the many that when we were doing the vaccination, I made it a point. I probably even became like ronco. I couldn't talk no more because I was like a like a recorder. But I wanted to be there in person to be able to talk to everybody. Every single person that received their vaccine, I wanted to, me personally, as the infection prevention director, to be able to talk and guide them. In the sense that I'm like, yes, you're getting vaccinated does not mean you're not going to get COVID. And unfortunately, that has not been the message that we've conveyed over across the board. Everybody feels that they're not going to get COVID where they're vaccinated, and look where we're at right now as far as the infectivity rate. It's like what it does, it protects you against getting severe COVID.
Which is the one that, of course, leads to death.
Correct. Okay. Just like the flu shot. The flu shot, yes, it protects you against not dying from flu. Yes, you might feel miserable for it for a couple of days, but guess what? You're alive. You know what I mean? That's the research. That's the general practice behind vaccines. You know what I mean?
It's almost like thinking that if you wear your seatbelt, you'll never crash.
Like you'll never die from a car accident.
Like you're never going to crash if you wear your seatbelt. No, you just probably won't get as injured or you won't get hurt, but that doesn't prevent the car from crashing.
Correct.
That makes a lot of sense. I think for me, I don't know how I got, but it was clear to me, but you're absolutely right. When I talk to friends, family, or when I see it out there, it's not about the vaccine being that, oh, ya estás bien, or no te va a pasar nada. It's more of this is going to help you with future infections.
So now take a look. Now, going a little bit more like peeling the onion, right? So what happened why do we have such a big spike? Yes, Omicron is more contagious. I get it. But because of that false sense of security that I'm vaccinated and I'm not going to get it, guess what? We went to our old behavior. And what do? Christmas, we got together, etc. And I get it that the CDC was indicating, okay, yes, you could get gathered together, etc. But it's still, you could still get it as far as the disease. And that's where we're at right now. Because of everybody feeling a false sense of security that I'm vaccinated, I'm not going to get it. This is where we're at right now.
Ew, I like that. Now, as far as spikes, we're definitely going to talk about the variants because, first of all, I have a question on who names those variants because, again, the Delta one that they said is like, okay, se los dejo ahí, but the Omicron is going to scare people. Y digo, oye, okay, what's going to be the third one? Like, I see they're going to put a name in Spanish de un luchador. I don't know what's going to happen.
It just depends on who's the one that identifies it.
No me digas que el señor Omicron es el que, Mr. Omicron.
It just depends. Like I said, in 2013, it was the MERS. It was the Middle Eastern SARS. That's what it was known as. So it just depends on the region. And let me put it this way.
Go for it.
Africa itself, right? And this was back in September of last year. I think they had just vaccinated 1% of their population. 1%. So put it in context. 1% of their population is vaccinated. How many more, once it burns out, what do you think, how many more variants are going to come out of that?
Yeah.
India, I remember, they're the largest vaccination for Pfizer, right? And unfortunately, in this case, they have a low vaccination rate because they were not able to actually, they're producers, yet they don't own the vaccine, so they couldn't get it to people's arms because that is being shipped out to countries that paid for the vaccines.
Yeah, and that makes perfect sense. To close out the conversation of vaccines, let's talk about the booster.
Yes.
And I'm going to give you my true opinion on boosters, right? I haven't taken a booster, by the way. No les quise decir in case no venían, by the way. But now on the booster, I do feel that, hey, like I took the vaccine because, there's so many things going on. And like you said, it is better to have something. But then the booster makes me think, okay, so then is the booster every 3 months? Is it every day, every week? Is it every day? And then now I put myself personally, like I'm healthy overall. I do exercise, which is one of the biggest things as far as the mortality on this disease is like if you're overweight and stuff like that, right? So I say, ¿sabes qué? Chances are they'll be okay. And going back a little bit to that mindset of, pues es que they haven't tested, is the booster a little bit more of the other vaccine? Is it like a booster que dijeron, no, pues ahí está tu Chocomilk? Again, my own personal thing. So I haven't gotten a booster because of that, and I don't think I'm going to get one because of that, right? Because, again, me thinking that, all right, I got the main thing. I got my main medicine, if you want to call it that. I should be good. Yes, duo, because I don't think COVID's gonna, and I'm gonna ask you this right now. I don't think it's going away. I think it's just gonna stay with us in some way, some shape or form, right?
Correct.
So I'm like, I'm not gonna take boosters every year, every 6 months. So I haven't taken that. I don't know if a lot of people share my mindset, but what are your thoughts on the booster?
I have a question for you.
Oof.
Do you take a multivitamin?
God, that's such a good question to ask me. Yes.
Okay. Do you just take it once and that's it, and then expect that those effects are going to be lasting?
You got me there. Okay. Now,
food for thought, right?
Yeah.
So that's what happens as far as vaccinations right now. This
now, is there? Let me interrupt you, and I'm sorry.
Yes.
This is the first time I hear of a booster. I have heard vaccines for stuff, so tómatela. But a booster? Do we take boosters for the other vaccines that we?
Some, yeah, absolutely.
Which ones?
Yes.
I never taken a booster of like something else.
That's the weird thing that a lot of people don't realize. All the vaccines that are
actually require boosters.
Yeah.
What?
So the flu shot, for instance, you get one annually because
that's
there's
a booster.
Not me, but okay.
Tdap, the tetanus, you get every 10 years.
Okay.
And that's when you get stuck with the rusty nail.
Okay.
So you want to make sure that, every single time if you have one of those encounters, you want to make sure that you're vaccinated for that, because then it could lead to complications.
Is this a booster the same vaccine? Is it a different thing? It's the same thing.
It's the same component.
Okay.
Because we held these clinics ourselves. It's the same vaccine. It's the same one that's arriving. It's just that you're getting a booster immunity. So think of it like sound waves, right?
Ooh, okay.
Perfect, right, for a podcast. And here I am just trying to give you an example so you can understand in context. So the sound waves are going like this, right? So that means that it's going well, right, as far as the sound. But all of a sudden it just starts to plateau. And what happens? That means that there's no sound coming in, right? I'm trying to give you an example. Similar as far as with your immunity, right? You're gonna have those fluctuations, but then there's gonna be a point where, okay, if you're no longer getting exposed to it, and there's a high infectivity rate, which is where we're at right now, you want to give that shot, that jolt, as far as in your immune system, so it could start producing it, and we could get you back. As far as being protected. Those antibodies to protect you.
What's the recommendation right now on boosters? Like just one after, I don't know, talk to my boosters. I have no idea. What is the recommendation right now?
So as far as the boosters is after, I think they just updated, I think, up to 5 months after your first series now.
Okay.
It used to be 6 months, and I think within this past month they already updated now to.
Are you saying up to 6 months after I taken it? What if
from your primary series? Mm-hmm. Then 5 months have lapsed, take your booster.
What if I didn't do that? Do I still take another booster a year after my original vaccine?
So, again, this is a new virus.
Yeah.
So it's still not been approved as far as for you to be taking concurrent boosters at this time. The one that's been the EUA, the emergency use authorization, it's been right now authorized for currently a third dose, which is considered the booster.
And all companies have this booster, like Pfizer, todos, or just one brand that has this booster?
But there is recommendations. So, for example, if you receive Johnson, which is the one that gets you at 70%, they've now done research where they recommend for you to take an RNA vaccine, which is either the Moderna or the Pfizer. So it gets you up to that 90% as far as immunity.
Interesting.
If you have Moderna or Pfizer, you could interchange it. They're mRNA, so you're fine.
Okay. Now, just to counterattack to what you told me right now, I couldn't come up with a better word. Am I right that if I'm a healthy individual, no asthma, of course, no underlying conditions at all, and the biggest thing is, again, my exercise, do I still need a booster?
Yes.
Okay, dime por qué.
Okay. Let me give you
give me another example. The first one that you said, it was great, by the way, but give me another one.
Let me give you an example. I know that we're saying that as far as if we're healthy, then there's no need for vaccination, right?
No, not vaccination.
No, but let me just give you an example. Well, I have some as far as boosters, right?
Uh-huh.
When it came as far as this is one of our friends that is cycling, mm-hmm. and pre-COVID, prior to vaccination being available. I mean, COVID affects everybody different. You know what I mean? This gentleman, like this guy, he was a cyclist and he is like in top shape. You know what I mean? And he ended up getting COVID to the point that even 5 months later, he was with his oxygen tank. I ran into the store with him. And
someone from El Paso, like someone that you know.
Yes.
Okay.
Yes. Completely, like, seriously, gym, cyclist, and that takes endurance for you to be riding for X amount of miles.
Yeah.
And so, again, you just don't know. I feel like at what point do you want to make sure, I guess, do you want to risk the odds? Now, as far as boosters, yes, one thing where I do recommend them overall, as far as because of the high infectivity they're having right now at this current time, every single body reacts different. You might start that immunity may start to dwindle down, and you might not know, thinking, hey, you know what, I'm covered. I already got my series, and guess what? Then you go out, and guess what? You're gonna get it. And those are the breakthrough cases that you're hearing every single day that are happening. But if you actually deep dive and you start looking at those, guess what? I had an individual, because that's what I do, right? We OC Health as well. All of the employees have to call us. And so when I'm doing those calls, I there was an individual that he got COVID again after vaccination. But I really took it a point to have a conversation with him. And then he was like, you know what? And he's like, no. He's all like, it is a blessing as far as vaccinations. He's like, I had COVID prior to vaccination, and he says I was like dying. He's like, to the point that it cost me to even get up to go to the restroom. Like, that's how much in dire pain of fatigue and tiredness that he was. And he says, as far as now that I have COVID after vaccination and booster, guess what? It's like a bad cold. And I'm like, I'll take this 100 times. And I was like, that's a perfect example as to how vaccination works. Now, the only reservation where I have as far as boosters is that I feel that when we talked about it, right, we are in a pandemic. And I gave you the example as far as Africa, right? We need to start approaching this as a global community. We're having such enclosed mindset in the sense that we're like, okay, we got to vaccinate United States, and we got to vaccinate, and we have to get another booster. I heard Israel's already giving the 4th booster now. And I'm like, I get it. Yes, I get it. But at what point are we also going to have to start switching our mentality, our mindset, that this is a global pandemic? Because if that 1% of Africa, and I don't know what the ratio is as far as vaccination right now as opposed to September, what if another variant comes that basically is going to laugh at our current vaccine? We don't know. You know what I mean? And so we just need to make sure that as a global effort, we're able to start vaccinating. And we saw that here in our backyard with H1N1 in Mexico. We were able to eradicate it because we vaccinated across. And if you get your flu shot right now, it still contains H1N1 because we want to keep that at bay. Because the swine flu, that's another whole pandemic that they're always in the lookout. As far as studying birds every single year, you might not know that, right? But they're studying the birds because they want to keep it at bay. Studying the pigs, the porcine, because they want to keep that at bay as well, because those are always threatening emergent diseases that are just lurking around in our backyard.
Nice. Thank you so much for that conversation. Transitioning a little bit into masks. I think I don't know if I talked to Tommy Gonzalez or was it Jutsu Maniego about mask, right? I remember vividly, long time ago, that the head of the CDC said that masks, they don't work, right? And then after that, it was a correction that N95 masks do work because those are the ones that professionals use, right? When I go out there to restaurants, let's take that back, not restaurants, but Walmart or other places, people, for the most part, I think they wear masks for the most part, right? But my opinion is that they wear only like 5% when wear the N95, others is just whatever mask. And it is my opinion that, you know what, if professionals are not wearing the others, then I think that's just a waste of time you putting in whatever. Again, if it's not N95, if it's, you guys seen the regular cloth, like the like whatever else, right? You've seen that. It is my opinion that all those, it's just a waste of time. You might as well not use it if you're not wearing the one that the medical staff, N95, they do wear.
But it's important to take into context when we're wearing N95s. So we wear N95s. First of all, we're fitted for the N95. So it's important for people to know that the medical professionals, we don't just grab whatever N95. We go through a fitting process, and it's actually done annually. It's done when you're hired and annually. So you get one that's fitted. So they fit it to make sure that you get a good seal. There's rules in place. Like if you're wearing a beard, you're not really going to get a good seal. And we wear it because we're going to be doing procedures that could cause what's called aerosolization. The patient's going to be breathing on you. The patient's going to be, spitting up on you. The patient's going to be throwing up on you, coughing in your face. So that's why we're wearing an N95. For the regular people, you're probably not going to Walmart and having people cough in your face, or you're intubating a patient, sticking a breathing tube down them, and all their air particles are going into your face.
In an enclosed space.
In an enclosed space, like inches away from their face. So that's why we don't wear an N95 just all over the place. Yeah. We wear an N95 in high risk situations where we're going into
because
rooms.
those work, right?
Yeah, But in everywhere else, we wear just a regular mask as well. We wear a regular mask because something is better than nothing.
There you go.
So let me give you a little bit of explanation in regards to the mask thing. Okay. So let's say we're in a bus, right?
Yes.
And let's go even pre-pandemic, because I feel like right now we're always like in the whole. I think it's never going to change no more. The mindset that we're going to be like, pre-pandemic we did this, and then post-pandemic we did this. Example. You're in a bus, right? And there's a tuberculosis patient in there.
Okay.
Or just say infectious patient, right? And if he's coughing up a lung, right? In other words. And if everybody's wearing the mask, but he's not, what is that doing?
Ask me that again.
So you're in a bus, right? And there's patient coughing up a lung, you know what I mean, overall. He's coughing, let's say it's tuberculosis, right? Or any other highly infectious disease. And everybody else in the bus is wearing a mask. What is happening?
Everybody's wearing a mask except him. That person. Oh, okay. Well, there's a high chance that the other guy. What type of mask are they wearing? Wait, before you get me, what type of mask are the other people wearing? Because if they're just a regular, not N95 mask. You know what? I go with what Christy said, that something's better than nothing. But I wonder what that something really is. Is it 5%? Is it 10% of like the N95 that gives you, let's call it 100%? And
so the example that I was getting to, because previously, as far as pre-infection control and so forth, you know what I mean? Back then, everybody, like for example, in healthcare setting, they would always everybody in the hallway would cover their face when they were bringing in somebody that was like, for example, a tuberculosis patient, right? But the TB patient would not wear anything. And what is that doing? They're cross-contaminating
they're still spreading
the hallway,
the
wheelchair, everything that they're coughing in. So think about that bus, right? Now, if they're coughing onto the where you hold yourself, guess what? That's contaminated. If they sit on a chair and they're coughing, well, guess what? That chair is not contaminated. Now let's switch the scenario around. If that bus is full again, right? But if that individual is wearing a mask and they're coughing, are they contaminating the handle? Are they contaminating the chair? Are they contaminating? No, they're not.
Not to that same level.
Because it's contained within the mask. Yes, there's a certain as far as masks. You know what I mean? If I'm wearing a sheer little thing, no. The recommendation is a triple layer mask. 2 to 3 layers as far as regular cotton, as far as mask. You know what I mean? You've seen some individuals that it's like lace, and it's like obvious. I get it. Yeah, it's not really protecting anybody. But as far as that's the premise, and that's sort of what got misconstrued at the beginning when the whole pandemic started in regards to the mask use. Yes, the practice previously is the one that's sick, because that's what they told the general public. There's no need to wear a mask. It's only the one, but they didn't stress out. It's like only the sick ones. But guess what? At that moment, the cat was already out of the bag, right?
Yeah.
Basically. Everybody was practically already infected. Plus, there was 20% of the people that you did not know that were infected. So you might be carrying the virus and not know. And if you weren't wearing a mask, guess what? You were going to be infecting others. So that's where you go in epidemiology and infection control practices. That's when you say, hey, everybody, let's just mask up. So we can minimize the transmission.
Yeah, and again, I'm with you. I just wanted to give you my opinion on the N95 because this is the one that when I wear, that's the one I try to wear for the most part. Mm-hmm. But you're absolutely right. I work at a place that a lot of people don't see that if you are dealing with millions or thousands, even this 1% improvement, overall, it's going to make a big change, right? So in the long run, that's why masks do work because, of course, maybe, again, going back to that 1% of maybe patients or people not being infected at the long run makes a big difference. And that's how we, little by little, of course, we try to treat this pandemic or at least this virus right now.
But we have to be a little bit careful, right? Because right now, one of the updates that are being given out is like, hey, N95s, that's the way to go. And guess what? What's going to happen is the general public's going to rush to go buy them. And guess what? Now as healthcare workers, us that are actually going like Kristine, that are actually in the room with these infectious patients, guess what? We're not going to have that. And we had it last year. We were running out of face shields. We were running out of that. Thankfully, we were so strategic and we worked. Oh, God, you should have seen Kristine. She's like a ticker. Automatically, every single mask, we had to have those conversations with them, with the staff that we were like, hey guys, think it like if you're in the Sahara, right, and you only have one bottle of water, are you gonna drink it in one gulp or are you gonna take it little by little? And that's how we had to use our PPE, little by little, so we do not put ourselves in that predicament. And you saw it across the news where everybody was like, they were running out of PPE and equipment and masks. Why? Because the general public took it for themselves, which you're not going to be doing an aerosolization procedure yourself.
Yeah, and it's funny how we as public or common people, we take that as, oh, okay, well, that's easy to buy a good mask instead of, hey, también dicen que don't be overweight. What are you going to do over there? You know what I mean? Like, ¿le vas a hacer algo? No, but let me put 3 masks of the N95. It's hilarious, but it happens.
How many times were you counting all that stuff?
So we were kind of lucky. I will say a funny story is the way that we first heard of coronavirus. So
okay,
I have to tell the story.
Go for it.
So when was it? Like January of 2020?
It was January.
January of 2020. This guy sends an invite out to people like at the hospital, and he's like, we need to meet because in China there's an infection that could potentially harm us. And he's like, we're going to have this call with the CDC. And he's like, I'll buy lunch so that we can meet. Nobody went to his meeting.
Yes.
Imagine if in we'd never heard of coronavirus. And he's like, there's this, infection in China. That we were like, what is he talking about? We have this other meeting that we have to go to about central lines or quality. But he didn't let that deter him. He was like, no, this is still important. So he started ordering more masks and hoarding them and taking them out of areas where he knew they don't need them. We need to stockpile since January of 2020 so I think we were lucky in that sense that I'd say it was like Chicken Little, the sky is falling.
Yes.
But we had never even heard of this, coronavirus. So we didn't take him too serious. And then once they started talking about it in March, we were like, oh.
Hey, did you send a follow-up email saying, les dije, hijos de la fregada? Or you didn't do that?
Oh, every day, Kristine would be like, now I'm eating, breathing, living it every single day.
Because I think at the time I was like, well, you're infection control. You can go to the meeting and just let us know.
Just let us know. Send us. Wow.
Yeah, just send us a post-it if you need something. And all of a sudden it was like, okay, now everybody's infection control.
Wow.
Exactly. And she's the lead of education at the time. So guess what? She had to educate everybody on this.
Wow.
So then also with the PPE, another cool story is we just didn't know, right? So in the beginning, we were very fearful. We're like, oh my gosh, we're going to use 1 million face shields. It's going to, so we started counting every single item of PPE, and every day our materials management team would give us a count. And every day I would follow it and give reports, and I would tell departments, where did these masks go? And where did those masks go? Another thing, that on the weekends, we would make our own face shields. Mm-hmm. So we
went to Tejas,
Really?
in downtown.
It's like a fabric shop. And they sold, and I don't even think they knew at the beginning why we were going, and we were buying. You know how they make the manteles, like that your mom probably put on the plastic ones?
Yes.
So we're like, we need a roll of that. And we made our own face shields just in case we ran out.
With Coban and then the foam.
And then we freaked out because this place closed. Like, once they started closing the business, they closed. And we're like, oh, no. Oh, crap. Where are we going to get more of this stuff? But this company opened, and they brought it. They brought it to us. Yeah, they brought us more rolls. So that was, I think that was my favorite. Okay, so I don't know if this is, like, you could say my favorite part. But my favorite part of the pandemic was the community. And I think it reminded me why we do what we do, and that we have an awesome community. Yes. And anything that we needed, we got it. And there was nobody that wasn't willing to go out of their way. My other favorite story is we were the first hospital that started screening employees at the entrance. So back in early March, we started taking temperatures of employees, and we started asking them about symptoms. And I'll never forget, I was there the very first morning, 3 o'clock in the morning, when we started doing that. And it was horrible because the only thermometers that we had were the kind that you like roll across your forehead. Well, if you can imagine where we work, it's Texas Tech. It's it's thousands of employees and visitors that go through that entrance. So how time consuming would it be to be taking the temperature like that? So I was like, this is absolutely not going to work. So by the time that we needed those exergen thermometers, the kind that you just point.
The restaurants use now and other places.
Uh-huh. Yeah. Well, back in March of 2020, I don't know if you guys realized, you probably realized there was nothing. We couldn't find any. You couldn't order it. So I had an idea to call the school district. Uh-huh. And we had close relationships with the school district, the school nurses, because we did different events with them. Mm-hmm. And it was something, it always tears me up that the school nurses, YISD, I graduated from Hanks. YISD, they went and the school nurses went back to their schools, and they gave us their thermometers. Yes. And they brought them to us. And that's what we used in the beginning until we could get ours. And so when we started vaccinating, one of the things that I made sure was, hey, we're going to have a few extra doses. And I was like, the school nurses are going to get those doses. Mm-hmm. And I got to vaccinate my school nurse.
Oh, that's so cool. Wow. That's one, as you guys were talking about, I'm like, wow, that's so cool. That's one of the reasons I'm doing this. Because, again, I don't want to just interact with people famous, El Paso famous, of course, or people that have a lot of followers. Just real people doing great stuff in our city that maybe we don't know about. So
yeah, we wanted to. We really were
like lots of places started. We wanted to people with like 3D printers. People with like 3D printers started bringing us face shields. Like little kids would.
UTEP started doing their 3D printing as far as face shields. Even looking at the ventilators, remember how the ventilators, how you could do multiple people with the same ventilator, put 4 people with one ventilator, which is in the ideal setting is, it's just for one person. But at that moment, we were like, hey, let's be innovative, because we saw what was happening in Italy, and we knew that wave was just coming. You could see it every day. I would see those maps.
And you knew it was coming.
Yes, and you could see the wave of the dots, and it was coming. And we're like, let's not put ourselves in that predicament that we find ourselves in dire need. And you saw it. We became the second hotspot in the United States, and we went through very tough times during that time.
Why do you think we were one of the hotspot in the world at one point? El Paso.
I think it's our culture. I think a
lot
of it
has to do. Or what you mean?
No, I think the way that we live and we integrate with our abuelitas and our abuelitos. And
the warmth that we have, we hug, we kiss, to have that social distance, to not, not interact.
And also that mentality of, no. Once we have the problem, we worry about it. Ahorita, Ni te preocupes, right?
But a lot of people in our region live with their parents and live with their brothers and things like that. So, you know, you're going to have maybe spread a lot more because brother maybe got exposed at his work and now he brought it home and we live there too, or things like that. You know, the abuelitas and abuelitos, thank God for abuelitas and abuelitos, because who was watching our kids when we had to go to work and they were not at school?
Work multiple hours.
You know, kudos to, I have to, you know, I would never forgive myself, but kudos to like my mom who had to step in and all of a sudden become a teacher, because I had to work, you know, and even now still 13, 14 hours a day, and she all of a sudden had to become an elementary school teacher, you know, but knowing that we're exposing all these family members because of the interactions that we had. So what I did is I actually just, my kids for months lived with my mom because I knew I was interacting with so many people that I didn't want to have them back and forth. So that was kind of hard.
Well, again, guys, you guys really, and of course your peers deserve all the recognition.
And you just touched a very good point. That was one of the most stressful parts. The fact that that responsibility fell on, especially on education, to educate everybody within the organization, and at the same time for me to be able to come up with processes in place that were really not set. You know what I mean? Everything was so fluid with COVID-19. That responsibility to fall on us, you know what I mean? It's a privilege, you know what I mean, that we were able to be very successful. But yeah, thanks to our families that they understood that, we didn't see them. Honestly, I didn't see my family for, I probably went over a year.
Wow.
It was just across the window, and that was it. Because it came to a point, especially with the spike that we had, that was one less thing that I needed to stress out of having to find a ventilator if in the event that they had to be in that situation. Why? Because nobody was vaccinated. There was no vaccination.
And as leaders, I can just imagine whatever decision you were making, I'm sure you were second guessing yourself. I'm sure you, like you said, it's our first time, so I have no idea. But guess what? As leader, you have to go for it, and then you have to make other people buy into that idea. And I'm sure you guys deal with a lot of employees, a lot of people that, like they're still not okay with whatever. And
yes,
I can just imagine how that went.
Well, the episode with Samanil, where he's indicating as far as one of his most highlighted points where he identified, okay, we're in a pandemic. For me, it was one Saturday, I remember, where I had to have a serious conversation with my family. We were at work, we were there, we had a death that occurred, non-COVID related. But at that time, I don't know if you recall, when those send-outs, there were only different places across the United States that were actually doing the testing. So at that moment, it was a 7 to 10 days, right? I believe it was a delay of getting those results. So at that moment, we had to assume that this child was infectious. So there I am, trying to Google trying to find out as far as the CDC what guidelines there is as far as how to handle a body that is a PUI, a patient under investigation for COVID-19. Here we are, me and Kristine, we're trying to search that, and here my parents were like, okay, like out and about, and I'm like, you guys have the luxury to be at home. Well, we as healthcare providers, we need to be the forefront of this and ensuring the safety of not only our staff, our patients, but also as far as the families. It was very heartbreaking. We couldn't allow the family to come in this situation. You know what I mean? And
a lot of people, a lot of times they don't even understand, even knowing that you work there and you deal with it on a daily basis. Yeah.
And so that was hard when you're looking, and that stress that you have on your shoulders to provide that guidance. Yeah, I'm not gonna lie, it was.
Let me ask you, as leaders, when, for example, Christmas, Thanksgiving, in back of your mind, are you thinking, "Oh my God, here we go again! Here's another spike."
Every single time. Like she said, Chicken Little, right? I am that Chicken Little. As far as the facility, in 2019, we had the measles outbreak. Yeah. And so I got to say, because of the dedication of our team, that's one of the things that I think made us very successful also with our COVID-19 processes. because with measles, it's highly infectious. It's 90% infectious. And we had that outbreak happen. We made the news, et cetera. So just a couple of months later, here comes COVID-19.
But I think it's also important to note that I know I take it super personal to protect the staff, and I'm positive the staff realizes that they're one of my most important priorities. Even now, protecting them is something that, I mean, they're putting their lives out there on the line every single day going into these rooms. And so I think it's so important to protect them, but also we're protecting who they go home to, right? So one of the things I tell Jose Luis is, we need to think of not just the staff, but make them understand who are you going home to that also needs to survive. That, maybe they don't understand the risk. Maybe they didn't sign up, they didn't sign up for this.
Correct.
I think that's so important, and thank you so much for talking about this because, as you're telling, of course, you guys see this on a daily basis. Pero a mí, pues COVID's ending, no? Ya se acabó, or ya estuvo, or you know what, like the worst is behind us, so now let's get used to the new normal. And it perhaps might be, but then we are not acting, at least myself, like I used to, kind of like mindset-wise, and also kind of like what I do. And this is a great reminder, like you said, not only think about yourself, but other people.
Yeah. And I think it's going to take a little while for us to find that balance, right? Because we have to start to get back to normal practices. We're in no way saying like we got to live like this forever.
Correct.
Especially because one of the other things that we saw in the pediatric community is the mental health of the children. It took a toll on a lot of kids, their mental health. And absolutely us in the pediatric community saw that. We absolutely saw an increase in patients with suicide, suicide attempts and things like that. So how do we, find that balance so that we don't have to go back and completely shut down and put these children's mental health at risk as well?
Yeah, and we're going to talk about that, of course. But just to close with the subject, which we're not going to close it because we're going to continue talking about it. But I just want to, because as you guys tell me, especially how our community got together, especially the people like Samaniego, like Tommy as well, as far as how we were able to bounce back from the most infected city, one of the most, if not the most at one point, to the highest vaccination rate. Yes. And that requires a lot of great communication, a lot of through a lot of people, departments, different agencies, different little things. And right now, for the most part, we're at 93% fully vaccinated. Again, for if not highest, that's from the last time I checked. But again, that's just effort from our community, from everyone involved, looking at this is the best way that we're going to help
into herd immunity.
Mm-hmm. Nice. Well, I want to talk a little bit about you guys specifically. We touched a little bit on it, but of course, as first responders, you guys, are the first to respond to this pandemic, right? I talked a little bit about it, how my life has changed, the hair salon, at work, the podcast, other things that I'm doing. And I'm like, wait a second, but whenever I have a stressful day or let's call it that, I only can imagine what is your stressful day, like people really having to adapt differently. And like you guys said, not only me, my family members, right? Correct. So my question to you guys is like now specifically to you as well. And if you have cases of peers or other coworkers, please go ahead and share. How has all this affected your mental health?
I think a lot. I think one of the hardest parts was always, everybody else can kind of turn it off, right? They can turn off the news and just step away from it. But with us, we couldn't, because if we stepped away from it, if we didn't always know the latest data, to me, someone could die. You know what I mean? That means that our employees weren't protected. That means that patients didn't have the most up-to-date, information. So I think what started happening, especially because we were on lockdown with me, I was like, well, what am I doing here at home? I'm not fixing something. And I think my personality had always been to be a fixer. I need to go fix it. I need to go work on it. So we worked a lot, but because there was a drive, someone to protect someone. And I think that was really hard I know it was hard on our families. It had to be, because they're probably so tired of hearing about COVID. Yeah, absolutely. But I wouldn't change it because I really think of how many lives were saved because I know our staff was really protected. We didn't have the exposures that a lot of places have because we were so vigilant in educating and protecting them, making sure that we were one of the first ones to get the vaccine. We always had PPE, so I wouldn't change it.
At your lowest point of being stressed, of again not knowing, again when you were very close to your breaking point, what helped you get through that moment?
Reminding myself why you become a nurse in the beginning. So I remember, sometimes at 2 a.m. when we couldn't find someone to be screening the employees, because we always wanted to have someone there at the checkpoints checking temperatures, and I was there sometimes 1 a.m, 2 a.m, staying overnight, holidays, Mother's Day.
You were there for Mother's Day.
Yeah, we worked Christmas, all of them. But knowing like that's okay because I'm here as an employee. I'm not here as a patient.
And then you have a cause, right? You're fighting, like there's a cause that allows you to. It's
I
bigger
remember
than
that
me, right?
Mother's
That's
Day.
what I'm thinking.
I remember that Mother's Day, and it's so funny because I was like there in my Mother's Day outfit or whatever, and being like everybody kept saying like, oh my gosh, why are you working on Mother's Day? But then you look at the front of the hospital and so many people were there with like flowers and signs because their mother was upstairs in a hospital bed. And they couldn't see their mom, they couldn't visit their mom, and they couldn't talk to their mom because their mom was upstairs with COVID. Or their mom is in a body bag, out in the parking lot. So who am I to complain?
Oh, such a great approach. And I know you're talking about it, and this is something that I stress a lot, that for you it's like second nature. You're talking about it, but you'll be surprised, or maybe you're not because you deal with it, how many people don't have that mindset to really, like when you're feeling down or wanting to give up, like, hey, espérate, compare yourselves to like the other side of the spectrum, and you're so lucky to be.
Yeah, absolutely.
Right?
And I think that in a way we're blessed in that sense that every day we get to go to work and we get to see these families that, these families that are going through so much hardship. And I'm just like, this is hard, but I can't imagine being on that side.
Yeah, before I go to you, Jose Luis, the same thing happened to me in Christmas because I was home alone during Christmas. And then the people that knew are like, oh my God, I really feel sorry for you. Todo. But they were very serious about it and they felt sorry for me. Y a mí, kind of like I got upset because wait a second. If you know me, I have no problem being alone Christmas because the truth is, bro, there's people that there's like, no tengo nada, like, and if you feel that way, it's because you don't know me, and that got me upset. Porque también soy payaso. Pero the truth is, it's just that mindset of knowing when to turn it on and when to turn it off, because you have to use it towards your advantage as well, right? Because when you want more, right, if you want to get like a higher position, more money, también tienes que decir, hay otra gente que tiene, so I'm going to go for it, right? Instead of having that mentality, no, pues hay niños en África que se mueren, so I'm okay with money. No, espérame, you have to turn it off and on, right? So that's such a great approach. Señor Jose Luis, talk to us about your personal mental health during COVID.
It took a toll. Because...
Ahorita says, look, I'm 22. I see.
You have that weight. If you're the infection preventionist for the facility, you are technically somewhat like the little Fauci of it. And especially the fact that I have everybody looking up to me, and for me to have the answers for something that is new, that had not hit Ebola. Yes, I went through that in my previous facility where I worked at, but that was just, we had a scare and that was it, you know what I mean? And that's it. It died out within a week, you know what I mean? We found the results and that's it. No more cases. Here it's been nonstop, and here we are again. It's like that merry-go-round that you just can't get off. So having that stress on your shoulders of you're, like Kristine said, you know what I mean? I couldn't just turn off the news. I had to continue reading because guess what? I was the one who had to have the answer. And I'm not gonna lie. Yes, I did have a breaking point, and I did, and I'm humbled to admit to it, you know what I mean? Where my colleagues saw that, and it was in a meeting where I was like, guys, we have to ensure this is for everybody's safety, you know what I mean? And I'm not gonna lie, right now, currently, and I'm admitting to it, you know what I mean? I have thanked her many times, but I would have not able to have gone through this, you know what I mean? As far as we worked almost over 65 days straight.
That's 2 months.
Yes.
Wow.
Like through weekends, and I'm telling you, 12 plus hours. So when people are like, oh my God, I can't breathe with this mask and etc., welcome to our world. Welcome to our world. And having to be the go-to know of everything, just constantly being, you know what I mean? I would go to sleep still thinking of processes, of techniques, everything that I had to do. And did it take a toll? Yes. But I really, and I want to take this time, you know what I mean? This person on my right, like seriously, I would have not able to have succumbed to overcome it. I mean, her constant dedication, because honestly, that's what it took. And also the weight of that we had, that we are the ones caring for our borderland, our children in our borderland. So with more stress you have on your shoulders, because the last thing you want is a kid, you know what I mean, getting infected or died from it. Unfortunately, and it's unfortunate, you know what I mean, well, it's happened, you know what I mean? And it's not because of lack of trying, or, you know what I mean, it's just the nature of the beast. But that was, it's really hard. You know what I mean? I was barely able to take some time off this past November for Thanksgiving. That went 2 years. And Kristine hasn't, you know what I mean? We were both in the same predicament, that we were like, we can't take vacation because that means that we leave behind things that need to be accounted for, like the PPE, the screening, you know what I mean, all those things, you know what I mean, we needed to make sure that we were constantly on the go every single day. There was no sick days at all for us, at all. And we would just have to keep each other's, you know what I mean, pat ourselves in the back and be like, you know what, we're doing it for not only ourselves, but also for our patients and for our family members. One of the great things that Kristine gave me an example, and it was great to hear it on the hallways when any new hires would come from other facilities. It was great to see, be like, they would tell you, you know what, coming to work here, I feel very safe. Just those simple words, for me, it was like, okay, I guess it's so worth my craziness, me stressing, pulling my hair out, you know what I mean, that kind of thing, the endless nights. I guess it was worth it, you know what I mean, because if I could help and prevent one infection and death, for me, that's already a win. But yeah, it took a toll.
Thank you for sharing. And the worst thing is, I mean, it's still with the spikes and everything, no sabemos, no es como, oh, thank God that's over, and we're just looking back. We should have definitely had this conversation way sooner, because again, as someone that doesn't interact with COVID or doesn't see this on a daily basis, news, friends, family, whatever we choose to watch or to listen to. And again, thinking as far as, not that I have a large audience at all, es nomás mi mamá, mi tía, to be honestly, mi tía lo ve like 20 times. But the truth is that I'm thinking, how can we help? You know, y todavía andamos con payasadas about the mask, about the vaccines. And you're absolutely right that, espérame, okay, I'm not there. I can't like volunteer to be frontline, so relájate. But what can I really do if I'm serious about like helping a little bit, you know? Because again, maybe my little help combined with others, we can make a big difference, and it has, right? So again, it just that, as far as like when you guys are talking about this, I'm like, oh manches, and then I still have friends talking about the mask, how like getting upset at a place because they asked for mask. Cállate, tonto. Like, bro, there's people like really having to go through hard things, and you put in your mask even though you don't want it, even though whatever you believe, like, it's just so stupid.
I think one of the important things is being willing to learn and being willing to listen, regardless of what your beliefs are. A lot of times, maybe it's just the human in us that like to give our opinions about things, which is fine. Everybody's absolutely entitled to opinions. But I think making sure that you have researched the information, making sure that you understand both sides, right? Why does someone feel that way? Why does someone think that way before giving your opinion is super important.
Definitely. How about you, Christy? Was there ever a breaking point que decías like that you question what you were doing there y a lo mejor mandar todo a la fregada?
I don't know. We got a lot of good food. People kept bringing donuts. People kept bringing burritos. Thank you to all the people that kept bringing stuff. Yeah, absolutely. I think it got frustrating. I think one of the things with me that I always contemplate, and I guess it still is, and I'm sure every single mother goes through this. I'm absolutely not the only one. Is, am I sacrificing my own kids? You know what I mean? Am I sacrificing my own kids to protect other people's kids? To where I'm positive I see other people's kids way more than I see my own kids. And so kind of finding that balance and making sure that I want my kids to understand that, this is for them, because at the end of the day, the reason I do what I do is because the day after tomorrow, if they were to ever need hospital care, if they were to ever need to go to an ICU, I want to know that they're going to go to the best pediatric ICU, the best children's hospital in the region. So making sure that they know that this is for them, because I want to make sure that you and the kids in your community have the best.
Correct.
Yeah. Because I'm not going to get tired of just saying thank you, because you guys are there, right? It's one thing to say, okay, to call you out or anything, but you guys are
and
there in the fight.
We're not the only ones.
Oh, of course.
Yes, it takes a village.
Yeah.
It takes a village. And we're all day in, day out. Over the weekends, we still have huddles, calls, because we need to make sure that we can't take off the pedal off the gas.
Yeah, relax or anything.
And because if not, then we get to where we're at. And that's what happened overall. We took our guard down and look at where we're at.
Wow. As I was doing my research, I checked that Frontline workers just like yourself, especially you guys, you're at least twice as likely to get sick, get COVID, right? Are you guys worried about yourselves, your family? I think we mentioned a little bit, but what are some additional precautions that you guys are taking, or are you guys a little bit more worried than me, like the regular person that doesn't interact with COVID on a daily basis?
I'm actually super lucky in the sense that my family, they just listened. I don't know. I got super lucky. I sent my kids with my mom. And my mom was awesome. She took care of them. They're obviously back now. But when the vaccines came out, they were absolutely not hesitant to get vaccinated. We have like the Tia group text, right? Where like the Tias and the cousins. So when I saw things starting to get bad, if you remember, I predicted the toilet paper thing. He did. I totally predicted the toilet paper thing.
You did.
I was like,
no, that's a clip I'm gonna post as well.
I predicted that.
No, she did.
I was like,
tell me why. Tell me why, because I don't get it. So you perhaps know why.
Because I just thought people are going to have to stay home, and they're going to need toilet paper. So go buy toilet paper before they all buy it. And none of us run out so I text my tias like, I know that this is going to be big. This is going to be really big. You guys need to get toilet paper, stay home, don't leave your house. And my family luckily was really good about listening. So I don't want to jinx us, but
should we get toilet paper again?
I think you should always.
That's not the answer. ¿Sí o no?
Yeah.
I don't think we'll get to that point again. Okay. Unfortunately, and we won't get there because of as far as the repercussions that cause an economy.
Yeah, we see that with
and it comes to the point that that's a main driver overall.
And that weighed heavy on me. I'm not gonna lie. Apart from all the crazy stress of the hospital and that, knowing that people were without jobs, knowing that people weren't getting checks, knowing that there was people in our community that stressed me out a lot too, to be honest with you.
To me, at least the people that I interact with, like, decía yo, well, you know where I work, right? And they were very lenient and a lot of benefits for people just saying, hey, I'm taking care of someone, and over someone like not really being sick, but being out for months y todavía getting paid. O sea, I saw a lot of the abuse.
Correct.
Y yo, no, like, really? Like, Oh my God. Well, again, that's just a personal choice you take, and what helped me to think is like, if they're really doing that, they have bigger issues at home. You know, like that's it. Well, okay, it's not only that they're like they have bigger issues if you feel okay taking advantage like that way. Pero bueno, ya me voy a mi trauma, my thing. But I also saw the opposite. A lot of people, especially like with businesses that they were able to get a lot of loans, a lot of money, even better than what they were before. Y yo, because of the way I set it up, y los inmigrantes que tenía de China, whatever it was, like I wasn't able to get qualified, approved for many of those. Like, I'm like, oh, really? Are you doing that? But yeah, I mean, you're absolutely right. There was those people that really, really, of course, were in need because of this. And definitely thinking about that, I think that's extra motivation for you to, hey, aguántate, whatever you're maybe going through. So
I think we were like, oh my gosh, let's just hurry up and get through this because I want them to be able to open up and make money. And it was stressful knowing that all these, at least for me, knowing all these businesses were closed and people were without eating. And
even right now, like my hair salon, which I don't do hair, but I mean, I explain you guys kind of like the business model. Todavía no se sabe. There's weeks that are really good, and there's some weeks, and of course, there's a direct correlation between spikes, people that say, I mean, with COVID still there. So like, as a business owner, thank God I have another job that I can go out and help in case I need. Pero la verdad, like, I can just imagine people that really depend on customers, and just because the CDC or something happened, or even there's spikes, ¿qué crees? Everyone suffers one way or another. But again, we have the direct impacts. Well, again, you guys will see and see the direct impact when, again, the spikes or everything else that's going on. Pero bueno, señores, what's the biggest lesson that you have, again, on a personal level, that you're taking away from COVID? Not that it's going away, but so far, what's the biggest lesson that you guys have taken from all this mess, from this pandemic?
for me, it's how amazing our community is. I think I've always really loved El Paso, and that's why I do what I do, and that's why it has motivated me to stay in the community and to support our local children's hospital. But I feel like our city is so unique, and I wish that people took more pride in that. We have been through so much. So the children's, the hospital where we're at, think of the influx of migrants. That absolutely affected us because all of a sudden we had an influx of little kids, coming to us. And we've been able, and I'm not even going to use the word adapt because we didn't adapt. We were able to do things that other cities absolutely could not have done and support them and be super empathetic and loving to these immigrants. And then the August 3rd shooting happened. And one of my favorite stories about where we work is that when we got there, we didn't have to call staff. There was no point where we were like, guys, call in additional nurses because there's going to be influx of, our staff just showed up. They knew, we didn't have to make phone calls like, hey, can you come? Because we're going to need help. They heard that happened and they just showed up. They ran towards the crisis on August 3rd. So that was super amazing. And then for this to happen and the outpouring of support that we had was super special. So the lesson I learned is that our community can overcome anything.
Nice. That's good. That's really motivating, especially when you're feeling down and there's support from other people. Nice. Mm-hmm. How about you, Señor José Luis?
Oh, this is a hard one. Our community, looking as far as what we had done or what had transpired in the previous year, and knowing that we could come together overall to really, let's take that peak down. You know what I mean? Let's stop being a hot spot. Even though it was challenging of having to stop seeing our loved ones, so we were able to slow down that curve. You know what I mean? And one thing that I do, as far as, I guess, from my perspective, as far as infection prevention, is that confianza. How do you say confianza?
Trust.
Trust. Exactly. That trust in our healthcare community, as far as like the general population. You yourself said it. We're over a 90% vaccination rate, And for everybody to be like, hey, you know what? Once this becomes available, let's get vaccinated. And that's what's going to help us become that little utopia, you know what I mean? As far as being able to really get it down. Now, we just need to continue on that momentum. And lesson learned for me is just making sure that I continue to be that educator for that general public, being that Chicken Little. Because that's what I'm known for, right? Being that Chicken Little, not only for the organization where I work at, but also for the community. Any opportunity that I have to educate the general public, by all means, you know what I mean? That's something that I think made a very big difference and impact, maybe just for those individuals I was able to vaccinate. And that was one example that you brought up in one of the meetings that you had, as far as the safety that, you know what I mean, how many families were able to impact that healthcare workers did not take COVID to their homes. Automatically, how many abuelitas were we able to save because of our due diligence of being that you could say stringent, or I don't know, you know what I mean, that dedicated. So that for me is a lesson learned. Never did I think that I was going to go as an infection preventionist, go through a pandemic. You know what I mean? It was unheard of. Again, 100 years it happened, but now here we are again, and in hopes that we could see the end of the tunnel. But we all have to do our part. That's the general practice on this. That's the thing that we have to learn. We have to do our part. Every single one of us.
That's my next question before I ask you my last question. Thank you so much for the time, by the way. What can we do, regular people, to help out? What is it that we can do? Just continue on our Snacks. Okay.
Drop off snacks at the hospital.
Okay.
That was the
we
best
can help
part.
with that. Okay, definitely. ¿Qué más? What can we do?
I think be willing to learn, be willing to listen, really understanding that, you know, we don't go into these professions to harm people. We don't go into these professions. Absolutely nobody would do this for any other reason than the love of serving others.
Yeah.
So being willing to understand that maybe you're not the expert just because you read an article on Instagram. Being willing to be open to information and trusting experts.
I like that. Señor José Luis, do you have another thing that maybe the, again, everyday person like myself can do to help a little bit?
Getting reliable sources. Don't, like you said, pretty perfect, right? Just because you read an Instagram story or a thing, automatically that makes you an infection preventionist or a scientific expert. Because down the road, that information that then you yourself, without having to fact check it, is misinformation, and it could lead to it could be the butterfly effect. It can lead
to other actions that, of course, are gonna in the future.
Exactly. Yeah. Then people may not have the sources, or may not have access to it, and they're gonna believe that as truth, and unfortunately, it could lead to bad consequences. And I think that that's one of the things that's happened right now with the current situation. We've gone away with actually, you know what I mean, believing on the scientific community, the healthcare community, and versus making it a very political aspect, when we have to just look at the science. There's vast research. We've all done it. You know what I mean? Anybody that's, like you said, in this profession is because we want to do it to serve the better. You know what I mean? We're not doing it out of malice. And so please, give us that opportunity to educate you correctly, because down the line, we want to make sure that we prevent from you coming to our hospital, you know what I mean, in a bad state, you know what I mean? Because at the end of the day, think about it, just logistically, think about it. That's more work for us, you know what I mean, overall. And not that we don't want to work, you know what I mean, but it's a work that can be easily prevented, you know what I mean? Right now, all the people, the majority of the ones that are sitting in our ICU vented just because they didn't want to get vaccinated. And then let me put it in a bigger context. Now, let's say you have a loved one that now suffers a car accident, heart attack, guess what? That bed is not available because of somebody that they read a Facebook page that said vaccination, you're getting a chip. Now that bed is being occupied by somebody because they didn't want to do it. Now your family, your loved one that is requiring that bed, guess what? They're in a waiting line.
Wow.
So, you know what I mean? That's the balance that you want to make sure that do not do a life-threatening decision based on something that is false, erroneous, you know what I mean? Because it could lead to a negative impact, and that can be reversed.
Those are really good from both of you. Thank you so much. Now, Christy, by the way, before I ask you the last question, you should know, by the way, Christy told me that she has watched most of the episodes, if not all. And I'm like, oh my God. I feel like, thank you so much for that alone. But you know that the last question is usually one thing you like about El Paso, one thing you would like to change. I want to, of course, tailor a little bit to the pandemic. And you guys have talked about it as far as one thing that El Pasoans have done right. But give us something that we need to improve on. And again, you guys already said maybe the sources, maybe not believing everything. You already also talked a little bit of the things that we have done right. Is there anything else that maybe we can include on that last piece of that question?
On what El Paso could do better. So the thing that I would say is really, I wish El Paso was more grateful of their community. I wish that we appreciated what we had more. Sometimes I hate when people start trashing El Paso or start talking bad about El Paso.
Oh, don't get me started on that.
Yes.
For sure.
Because I'm like, I don't think you realize all the amazing things that we have, and the people are amazing. So I wish that we were more protective of our community. And when we go out and we make these decisions about our health, that we think about the community around us and we do it to serve others.
Perfect. Well said. Another reason why I'm doing this as well. Because again, there's so many great things, so many great people like yourself. Now, that's why I'm taking a little bit longer to do the podcast as well. Because I don't just want to highlight people with like a lot of followers or business owners with a lot of money. I really want to serve a little bit for this to serve as recognition for someone that deserves it. You guys fully deserve it. Your peers as well really deserve for everything that you guys do. And I 100% mean it.
And we thank you for giving us this opportunity and platform to be able to provide this information.
Of course. Anytime. Is there anything else we need to talk about?
No.
Again, guys, thank you so much. Again, you have heard me say that again and again. I really mean it, not only for your time, but what you do for your family members as well, because the truth is that this requires a lot of effort, and you guys are the frontline soldiers right there. So again, thank you so much. And everybody, nos vemos. Adios.
Thank you.
Bye-bye.